Good evening. Welcome to the fifth week of our live interaction session for our course Biomechanics by Professor Vardhan from the Department of Applied Mechanics and Biomedical Engineering, IIT Madras. Myself, Manjunathan, a research scholar from the Department of Applied Mechanics, IIT Madras. So let's. I hope most of you have watched the videos for week 5. In week 5, some remaining part of the spine, then hip, knee and ankle, anatomy, muscles and movements. These were the major topics covered in fifth week of our course. We will start our class with a just a small recap of the videos, and then we'll move on to the questions. In our last session, we have mostly covered the spine part. So I am starting from the hip joint itself. So hip joint. So the hip joint is one of the important and one of the important joint of the body. It's of ball and socket type, where head of the femur is in a ball shape and it is coming to a socket shaped acetabulum of the hip bone. And like what we have seen in spine, here also muscles are separated into main groups. The muscles of hip are classified into three groups: iliopsoas, gluteal, and abductors. So these is the superficial pelvic and thigh muscles of the leg. Here uh, we can see the major muscles, and from here iliacus and psoas are the main iliopsoas group muscles in the what is seen in the superficial and pelvic view or anterior view of the leg. And next is gluteal group. Gluteal group has gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia latae. And then this is the abductors. Abductors are abductor brevis, abductor longus, abductor magnus. These are the main abductors of the leg, which help in the abduction adduction motion of the leg. And knee is the largest joint, and it's also a hinge joint, but it's a modified hinge joint because it allows more than the motions allowed by a normal hinge joint. And it is a main joint in our leg which help us to what carry our body weight as well as extra loads. And because of this difference in the body shape, that is lower part of the knee is very smaller compared to upper part, this is very vulnerable to the injuries. So knee joint is a two joint structure. The two joints are tibiofemoral and patellofemoral joints. And most of the injuries with respect to aging and not happening in the menisci. It's a layer of cartilage because in old age that knee pain, knee issues, this is kind of common in elderly people. So this is the main culprit there, which is known as the meniscus or meniscate because each knee has two meniscus. Which is a layer of cartilage which is act as a uh, buffer layer in between two bones, as well as it makes the it reduces the friction also, and also the wear and tear between the bones. And the knee joint or knee is kind of composed of the menisci, ligaments and muscles, because uh, as hinge joint there is only uh, lesser range of contact between two bones, and being the important joint to support the whole body, the stability is maintained by ligaments, muscles, and menisci. This is an anterior view of knee, that is looking from the front portion of the body. This is a sagittal section, that is sideways uh, lateral plane is being used to cut and see what is happening in knee joint. And this is a superior view, that is if this portion, this top portion is being removed and we are looking from the top, that view is here. And here you can see that three supporting structure, how they are kind of interconnected. You can see the ligaments, anterior and posterior cruciate ligaments, as well as the meniscus, medial and lateral. Medial is in the inside of the leg, that is between two legs, that portion, medial legs, and lateral is the outside, lateral side of the body. And these are the uh, two cartilage, that is two tibial condyle cartilages on medial and lateral sides. So this is a structure that is supporting the femur, the bone uh, coming to be placed or sit on the lower part of the leg. Next is some movement of our body is composed of, because some movement of our body is start from the hip itself, even though we feel it is happening in our leg or ankle itself, but some motions start from the hip itself. So the muscles in the hip, muscles in the thigh region is responsible for both the motions in hip and knee. So this is the thigh region, this portion. So here I have given a set of uh, muscles and what are the movements they are responsible for. So rectus femori, this is the large muscle, like rectus femori. It helps in knee extension and hip flexion. Next is vastus lateralis, this one on the lateral side, that is the outside of the body. And next one in the same counterpart inside the body is inside, I mean inner side of the body, inner side of the leg, sorry. Inside of the leg is vastus medialis, and in between there is vastus intermedius. These three muscles helps in knee extension. And sartorius is kind of a cross-linked muscle which helps in more than one type of motion, which are knee flexion, hip flexion, abduction, and lateral rotation. These set of six muscles are known as quadriceps femoris group in our uh, knee hip area. Next is hamstring group. Hamstring group contains of mainly three important muscles, which are semi-membranaceous, semi-tendinaceous, and biceps femoris. So here mostly these uh, three muscles has more movement compared to the last six. Biceps femoris and these three helps in equally take part in knee flexion and hip flexion, extension. And biceps femoris helps in lateral rotation, whereas semi-tendinaceous and semi-membranaceous helps in medial rotation. So whichever is starting with semi helps in medial rotation. This is the angle, that is the joint of foot and lower leg. Here the bones in the lower leg is tibia and fibula. It is coming into contact with the uh, complex of bones in our foot. These are some movements of the foot, and uh, here foot or ankle joint don't have any extension. Uh, we don't use the word extension here, but the movements are dorsiflexion and plantar flexion. Dorsiflexion, plantar flexion is the upward and downward movements of uh, toes, and aversion is the sideways movement to the medial and lateral side, and rotation, this external rotation and internal rotation, that is if we are kind of standing in one foot and kind of rotating our whole body inside, that rotation actually happens at the hip joint, not in the angles, which helps in that hip joint itself helps in external axial rotation and internal axial rotation. These are the muscles in the angle. Hope we can move on to the questions. Okay, we will start with our questions. I will read out the questions and give some time for you to think and recollect what you have watched in the videos. Try to answer the questions. Don't worry if it is right or wrong. If it is wrong, you can correct yourself from here. So let's start. First question is, the hip joint is classified as a dash. Options are: option A, hinge joint; B, pivot joint; C, ball and socket joint; D, saddle joint. Easy question to start with. What type of joint is hip joint? Is it a hinge joint, pivot joint, ball and socket joint, or saddle joint? You can inbox your answers. Yes, option C, ball and socket joint. You have seen that head of the femur is ball shaped and it is fitting into the socket in the hip bone. Option C, ball and socket joint. Next question. The acetabulum articulates with the which of the following? Options are tibial plateau, femoral head, greater trochanter, iliac crest. Question is, the acetabulum articulates with which of the following? Options are tibial plateau, femoral head, greater trochanter, iliac crest. Yes, this is the first question in different format. That is, acetabulum is the uh, depression or socket in the hip bone, and it articulates with the femoral head. That is a ball-shaped femoral head. Option B is the right answer. Femoral head articulates with acetabulum. Next question. Which ligament primarily prevents hyperextension of the hip? So here the question is asking which is the ligament that prevents the hyperextension of the hip. Options are pubofemoral ligament, option B ischiofemoral ligament, option C iliofemoral ligament, option D patellar ligament. So be careful about the question. It is asking which prevents, not which allows. Which ligament primarily prevents the hyperextension of the hip. Answer is option C iliofemoral ligament. So this is the iliofemoral ligament. Here is the hip bone and femur. This iliofemoral ligament prevents the hyperextension of hip joint. Next question. Hip flexion primarily occurs in which of the planes? Repeating once more. The hip flexion primarily occurs in which of the plane? Options are coronal plane, sagittal plane, transverse plane, and oblique plane. The question is about hip flexion. In which plane the hip flexion primarily occurs? Answer is option B, sagittal plane. So it's not transverse plane. It occurs about transverse axis or left-right axis, but it occurs in sagittal plane. Option B. Next question. Hip abduction occurs about which axis? Previous question was about plane. Here the question is about axis. Hip abduction occurs about which axis? Find that it is abduction, not flexion. Options are option A, mediolateral axis, option B, vertical axis, option C, anterior-posterior axis, option D, oblique axis. Abduction meaning, abduction I have already discussed in the first class itself. Abduction meaning taking away, something is being taken away. So hip abduction meaning the entire leg is being taken away or taken to the sides. So then about which axis the motion will occur? Answer is option C, anterior posterior axis. This is the abduction. So abduction happens in this direction. Then the axis should be going from anterior to posterior. So then only it should go like this if we are making axis. So this will be anterior, posterior, right, left, superior, inferior. So it is happening in anterior posterior axis. Next question. The primary hip flexor muscle is which among the following? Question is which among the following is the primary hip flexor? Options are option A, gluteus maximus, option B, iliopsoas, option C, biceps femoris, option D, adductor magnus. Try to answer the question. Answer is iliopsoas. This is the uh, primary or the powerful muscle. This one, this muscle, and this is actually combination of these two, iliacus and psoas muscle. So this combined uh, to create this iliopsoas muscle, and this is the muscle which is the act as the primary flexor. Next question, the strongest hip extensor. So before the question was on flexor. So here the question is, which is the strongest hip extensor muscle among the following? Options are gluteus medius, option B gluteus minimus, option C gluteus maximus, option D rectus femoris. Question is, which is the strongest hip extensor muscle? Yes, I already got that correct. That is gluteus maximus. Next question. Gluteus medius mainly contributes to which of the following motions? Options are option A hip extension, option B hip internal rotation only, option C pelvic stabilization during gait, option D knee flexion. Question is, gluteus medius mainly contributes to which of the following motions? Options are hip extension, option B hip internal rotation only, option C pelvic stabilization during gait, option D knee flexion. Answer is option C, that is pelvic stabilization during gait. Yes. If anybody wondering what is gait, gait is actually the locomotion, the manner of walking for locomotion, limb locomotion. The way in which you walk or run or move your limbs is what is known as gait. Next question. Which muscle group is primarily responsible for hip adduction? So before we have discussed abduction, here it is adduction. Which muscle group is primarily responsible for hip adduction? Options are option A quadriceps, option B hamstrings, option C gluteus, option B adductors. Simple question. Yes, answer is option D, adductors. Next question. The external rotation of the hip occurs in which of the following planes? The external rotation of the hip occurs in which of the following planes? Options are option A, sagittal plane, option B, coronal plane, option C, transverse plane, option D, frontal axis. Yes, option C, transverse plane. The external rotation of the hip occurs about the transverse plane. Next question. The knee joint is primarily classified as a which of the following joints? Options are option A, ball and socket joint, option B, pivot joint, option C, modified hinge joint, option D, saddle joint. What is the type of joint that knee joint belongs to? Options are ball and socket joint, pivot joint, modified hinge joint, saddle joint. Yes, answer is C. That is modified hinge joint. It is called as modified hinge joint because it gives more than the motion that normal hinge joint provide. Next question. Anterior cruciate ligament prevents excessive which of the following? Options are posterior translation of tibia, option B, anterior translation of tibia, option C, varus stress, option D, hyperextension only. So, which of the following does the ACL, that is anterior cruciate ligament, prevents? Okay, the ACL ligament, actually ACL ligament is a crucial ligament in most of the sports person and all, the ACL ligament tear causes serious issues for the knee, and this tissue is a connecting tissue between the femur and tibia. Tibia is connected to femur and tibia, and it is in the uh, central location of the knee, and it prevents the excessive anterior translation of tibia. That is option B. The answer is option B. And when there is excessive anterior translation of tibia occurs, or that typical rotation occurs in, sorry, translation occurs in a knee joint, that ACL ligament gets teared, or uh, a twist happens at the joining points, insertion points of the bone, sometimes leading to requiring some ligament reconstruction surgery. Answer is excessive anterior translation of tibia. Next question. The menisci function mainly to which of the following? Options are: produce synovial fluid. Option B, increase joint congruency and shock absorption. Option C, generate torque. Option D, prevent flexion. The question is on the meniscus of the knee joint. What is the function of the menisci? Options are: option A, produce synovial fluid. Option B, increase joint congruency and shock absorption. Option C, generate torque. Option D, prevent flexion. Option B, that is increase joint congruency and shock absorption. I have shown it's like two C-shaped structures which will uh, provide proper seating for the two bones. It will accommodate the head portion of, I mean, tail portion of the femur and head portion of tibia to be aligned to each other. So it has particular grooves or particular depressions to which the bone heads can be inserted. So which will increase the joint congruency, also in the shock absorption. Next question. Knee flexion occurs in which plane? In which plane does the knee flexion occurs? Options are: option A, transverse. Option B, coronal. Option C, sagittal. Option D, oblique. This answer is option C, sagittal. We have already discussed for hip flexion. So by the anatomical similarity itself, you can understand that both hip and knee flexion occurs in C, sagittal plane. Next question. Knee extension is primarily performed by which of the following? Options are option A, hamstrings, option B, gastrocnemius, option C, quadriceps femoris, option D, sartorius. Repeat the question. Knee extension is primarily performed by which of the following muscles? Options are hamstrings, gastrocnemius, quadriceps femoris, sartorius. Answer is option C, that is quadriceps femoris. Next question. The hamstrings primarily act to which of the following motions? Options are extend the knee, option B, flex the knee, option C, abduct the hip only, option D, stabilize the angle. The hamstrings primarily act to which of the following motions? That is, extend the knee, flex the knee, abduct hip only, stabilize the angle. So this is simply asking what is the primary function of hamstring muscles. So here you can simply eliminate option D. From other three only you only need to choose. Option is the correct option is option B, that is to flex the knee. Next question. The patella increases the mechanical advantage of which of the following muscle groups? Options are option A, hamstrings, option B, quadriceps, option C, gastrocnemius, option D, popliteus. The patella increases the mechanical advantage of which of the following muscle groups? Patella is the bone-like portion that is floating in the knee when you are touching the knee. That is what is known as patella. Yes, the correct answer is option B, that is quadriceps. Next question. Small rotational movements of the knee occur when the knee is option A fully extended, option B flexed, option C locked, option D hyper extended. When will the small rotational movement of the knee occur? When it is fully extended, flexed, locked, or is it hyper extended? Yes, option B. That is the right answer. When the small rotational movements of the knee occurs when the knee is flexed. Next question. The medial collateral ligament resists which of the following? Options are valgus stress, varus stress, anterior translation, posterior translation. Once again, which of the following will the medial collateral ligament resist? Options are valgus stress, varus stress, anterior translation, posterior translation. The medial collateral ligament resists which of the following stresses? Option A, valgus. Option B, varus. Option C, anterior translation. Option D, posterior translation. Our answer is option A, valgus stress. So in knee alignments, suppose I'll just draw the alignments. This is the hip bone. From here, femur comes. So this is the normal position. Whereas in varus, this is the hip joint. So this position, that is knee is kind of coming lateral side, is known as varus position, varus alignment. Similarly, when the two knees are coming closer to each other, that position is known as, that alignment is known as valgus. Mostly in clinical examination, these stress tests will be done to understand how much strong is your knees, to assess the strength of your knees. And this valgus stress, this stress uh, You can define it as the stress which that pushes a joint towards the midline. Whereas the varus stress pushes the joint away from the midline. Hope that is clear. Moving on to next question. Which muscle crosses both hip and knee joints? Options are vastus lateralis, option B rectus femoris, option C soleus, option D gluteus maximus. Question is which muscle crosses both hip and knee joints? Answer is option B rectus femoris is the muscle which crosses hip and knee joint. Next question. The angle, which is also known as talocrural joint, is primarily which of the following? Options are option A ball and socket joint, option B pivot joint, option C hinge joint, option D saddle joint. So which type of joint is a angle joint? Try to answer the questions. Our answer is option C hinge joint. So I have shown you the dorsiflexion and plantar flexion movement, that is the upward movement and downward movement of the toes. So from that moment itself, this can be understood the type of joint there. It is hinge joint. Option C, hinge joint. Next question. The talocrural joint is formed by the articulation of which bones? Options are option A, tibia, fibula and talus. Option B, talus and calcaneus. Option C, tibia and calcaneus. Option D, fibula and calcaneus. So the bone that the bones which forms the talocrural joint. This answer is option A. Tibia, fibula, and talus. The talocrural joint is formed by tibia, fibula, and talus. So here basically these two, that is tibia and fibula, this will form a socket. Something happened in the writing part, sorry. Okay, sorry. Okay, so basically tibia and fibula forms a socket known as mortise. And to this socket, the talus is fixed, or the this particular socket that is formed by tibia and fibula holds the holds talus. So that's why how three bonds are articulating in one joint. Next question. Dorsiflexion occurs in which plane? Dorsiflexion of the angle occurs in which plane? Options are option A, coronal, option B, transverse, option C, sagittal, option D, oblique. Simple question. Try to answer the question. In which plane does the dorsiflexion of angle occurs? Answer is option C, sagittal. That's the dorsiflexion and plantar flexion occurs in sagittal plane. Next question. Plantar flexion is primarily produced by which of the following? Options are tibialis anterior, option B, gastrocnemius and soleus, option C, peroneus longus, option D, extensor digitorum. The plantar flexion is primarily produced by which of the following? Tibius anterior, gastrocnemius and soleus, conius longus, extensor digitorum. Answer is option B, gastrocnemius and soleus. Next question. Inversion of the foot occurs in the which of the following planes? Options are sagittal plane, coronal plane, transverse plane, vertical axis only. The inversion of foot. So, other than dorsiflexion and plantar flexion, the other two movements are inversion and eversion. So, the question here is in which plane or axis does the inversion of foot occurs? Try to answer the question. Answer is option B, that is coronal plane. So, it is the tilt towards medial and lateral position. Next question. The primary dorsiflexor of angle is. Which of the following is the dorsiflexor of the angle? Options are tibialis posterior, option B gastrocnemius, option C tibialis anterior, option D soleus. Which of the following is the primary dorsiflexor of the angle? Answer is option C, tibialis anterior. Next question. The eversion is mainly performed by which of the following muscles? Options are option A, tibialis anterior, option B, peroneus muscles, option C, flexor hallucis longus, option D, soleus. So, which of the muscle performs aversion of angle? Answer is option B, peroneus muscles or fibrillaris group muscles performs the aversion of angle. Next question. The calcaneus primarily articulates with which of the following? Options are tibia, fibula, talus, and navicular. Question is the calcaneus primarily articulates with which of the following bones? Options are option A, tibia, option B, fibula, option C, talus, option D, navicular. Answer is option C, that is talus. The calcaneus primarily articulates with talus. Next question. The Achilles tendon attaches the gastrocnemius and soleus to which of the following? Options are talus, option B calcaneus, option C tibia, option D cuboid. The Achilles tendon attaches the gastrocnemius and soleus to which of the following? Options are option A talus, option B calcaneus, option C tibia, option D cuboid. Our answer is option B, calcaneus. Option B, calcaneus. Dactyly tendon attaches gastrocnemius and soleus to calcaneus. Next question. Which movement primarily occurs in subtalar joint? Options are option A, flexion, option B, extension, option C, inversion and eversion, option D, abduction only. Which movement primarily occurs at the subtalar joint? Options are flexion, option B, extension, option C, inversion and eversion, option D, abduction. Answer is option C, inversion and eversion. The inversion and eversion occurs in subtalar joint. So in angle, there are two joints. One first one is talocrural, where dorsal and plantar flexion happens. And in subtalar joint, facilitates inversion and eversion. So both talocrural and subtalar joints are the two joints which facilitates the four different motion of foot. Next question. Which of the following is true with regards to a hip joint? So which of the following is true with regard to a hip joint? Options are: it has lesser range of motion than the shoulder joint. Option B, it has more range of motion than shoulder joint. Option C, it allows for movement only in sagittal plane. Option D, it allows for movement only in frontal plane. So which of the following is true in regard to hip joint? So with regard to hip joint, it has lesser range of motion than shoulder joint. We have already discussed that shoulder joint has the maximum number of motion or the range of motion. That is, this is also written as in biomechanics, range of motion. So ROM for shoulder hip joint is always less than shoulder joint. All other three statements are wrong with regard to hip joint. The answer is first one. Hip joint has lesser ROM compared to a shoulder joint. Next question. Match the different types of joint with their corresponding examples. It's a previous question, exam question only. Try to answer. Options are the match the following groups are modified hinge joint, pivot joint, ball and socket joint, hinge joint. On the other side, atlanto-occipital joint, atlanto-axial joint, hip joint, knee joint. So find the correct pairing. Options are option A, 1A, 2C, 3B, 4D. Second option, 1D, 2B, 3C, 4A. Third option, 1A, 2B, 3C, 4D. Fourth option, 1D, 2A, 3B, 4C. Which is the correct mapping or pairing? Answer is option 2. That is 1D, 2B, 3C, 4A. That is modified hinge joint is knee joint. Then you can try to connect simple options, simple pairs first to eliminate. So one joins to D. So then only 2 and fourth option remains. So again, in today's class, ball and socket joint is hip joint. The other one is 3C. So here it is 3B. So it's wrong. Here 3C. Simply eliminating itself, you can find answers. So second one, 1D, 2B, 3C, and 4A. Moving on to next question. The primary function of intervertebral disc in the spine. This question is from spine. What is the primary function of intervertebral discs? Options are to allow rotational motion between adjacent vertebrae. Option B, to provide sensory feedback to the CNS, that is the central nervous system. Third option, to serve as attachment points for ligaments and tendons. Last option, to fill the gap between adjacent vertebral disc and provide padding during weight bearing. What is the primary function of intervertebral discs? Try to answer the question we have discussed in the last class. Answer is to fill the gap between adjacent vertebral bodies and provide padding during weight bearing. Option D. That is the primary function of intervertebral disc. Next question. What is the primary function of sternocleidomastoid muscle when contracting unilaterally? So this is a specific question. So this also we have looked in the last class, sternocleidomastoid muscles. Remember where is it is located. So what is the primary function of sternocleidomastoid muscle when contracting unilaterally? Options are option first option head flexion to the same side. Second option head flexion to the opposite side. Third option head rotation to the opposite side. Fourth option head rotation to the same side. Try to answer the question. The answer is second one head sorry third one head rotation to the opposite side. Sternocleidomastoid muscles are located at the neck and sternum region. So when it contracts unilaterally, it supports head rotation to the opposite side. Next question. This we have already seen. The head of the femur articulates with dash in the pelvic bone. The head of the femur articulates with dash in the pelvic bone. Options are greater trochanter, second one acetabulum, third one ischium, fourth one sacrum. So with what does the femur articulate in the pelvic bone? Answer is option B, that is the acetabulum. Acetabulum is the depression of socket-like structure in the pelvic bone, and the head of femur articulates with that socket called acetabulum. Next question. Which of the following movements are observed at the hip joint? Options are internal rotation, option B lateral flexion, option C, your third option is hyperextension, fourth one abduction. Which of the following movements are observed at the hip joint? Options are internal rotation, lateral flexion, hyperextension, abduction. So the question itself saying which of the following movements. So from itself we can see there is multiple options, multiple right answers. Try to choose all the right answers. Actually, we have already discussed uh, almost all the movements in hip joint. So then it's, if you recollect, it will be easy for you to eliminate. Correct answers are internal rotation, hyperextension, abduction. That is first, third, and fourth. Lateral flexion is not possible at hip joint. These three movements, that is internal rotation, hyperextension, and abduction, is possible at the hip joint. Next, dash is the largest joint in the human body. Simple question. Which one of the following is the largest joint in the human body? Options are first one, knee joint, second one, hip joint, third one, shoulder joint, fourth one, Atlantic axle joint. Answer the question. Answer is option A, or first option, that is the knee joint. Knee joint is the largest joint in the human body. Next question. Which of the following are not a part of the knee joint? Options are anterior cruciate ligament, second one lateral meniscus, third one patella, fourth one acetabulum. Find the options which are not a part of knee joint. Option is Correct answer is option D, that is acetabulum. Acetabulum is a part of hip joint, not the knee joint. So correct answer is option D, acetabulum. Next question. Which of the following are the movements at the angle? Options are dorsiflexion, extension, internal rotation, eversion. So which of the following are movements at the angle? Options are dorsiflexion, extension, internal rotation, eversion. correct answers are dorsiflexion and eversion. So we have already discussed uh, that at talocrural joint, dorsiflexion and plantar flexion occurs, and at subtalar joint, eversion and inversion occurs, and internal rotation occurs at hip. So first and last, 1 and 4th options are the movements happening at the angle. Next question. Gastrocnemius muscle is responsible for the following movements. So, which of the following movements is produced by gastrocnemius muscle? Options are plantar flexion, inversion, dorsiflexion, knee flexion. Which of the following movements are produced by gastrocnemius muscle? Options are plantar flexion, inversion, dorsiflexion, and knee flexion. Answers are plantar flexion and knee flexion. The gastrocnemius muscle is responsible for both plantar flexion and knee flexion. Next question. The outer fibrous ring of the intravertebral disc is called as what? Options are nucleus pulposus, annulus fibrosus, end plate lamina. So, what is the name of outer fibrous ring of an intervertebral disc? What is the name of outer fibrous ring of intervertebral disc? Correct answer is option B, annulus fibrosus. Is the correct answer. Annulus fibrosus. Next question. The nucleus pulposus primarily functions to which of the following? Options are prevent rotation, transmit compressive loads, Produce synovial fluid. Option D. Attach muscles. What is the primary function of nucleus pulposus? Try to answer the question. What is the primary function of nucleus pulposus? That's a question from spine. The answer is option B, transient compressive loads. Next question. The intravertebral discs are absent between which of the vertebral pairs? Options are L4, L5. Option B, T1, T2. Option C, C1, C2. Option D, L5, S1. The intervertebral discs are absent between which of the following vertebrae pairs? Is it L4, L5 or T1, T2, C1, C2 or L5, S1? Answer is C1, C2. Intervertebral discs are absent between C1, C2. Next question. With aging, the water content of nucleus pulposus, option A increases, option B remains constant, option C decreases, option D doubles. And the simple question. What will happen to the water content of nucleus pulposus with age? Yes, option C decreases. With aging, the water content in nucleus pulposus decreases. Next question. The flexion and extension of spine primarily occur in the which plane? Options are option A transverse plane, option B coronal plane, option C sagittal plane, option D oblique plane. In which plane does contraction and extension of spine primarily occurs. Its answer is option C, that is sagittal plane. Next question. Lateral bending of the spine occurs in which of the following planes? Options are sagittal plane, coronal plane, transverse plane, and horizontal plane. In which plane does the lateral bending of the spine occurs? Lateral bending meaning sideways bending, and that occurs in coronal plane. The lateral bending of the spine occurs in the coronal plane. Next question. The axial rotation of spine occurs in which of the following planes? Options are coronal plane, sagittal plane, transverse plane, and frontal plane. In which plane does the axial rotation of the spine occurs? Options are option A, coronal plane, sagittal plane, transverse plane, frontal plane. Answer is option C, transverse plane. Next question. Rotation is most restricted in which spinal region? Rotation is most restricted in which spinal region? Options are option A, cervical, option B, thoracic, option C, lumbar, option D, sacral. So rotation is most restricted in which spinal region? Answer is option C, lumbar region. Rotation is restricted. Most restriction in the rotation is in lumbar region. Option C. Next question. The primary muscle responsible for flexion of the neck. The primary muscle responsible for the flexion of the neck. Options are option A, trapezius, option B, sternocleidomastoid, option C, splenius capitis, option D, levator scapulae. We have already discussed the same question in different contexts today. Primary muscle responsible for flexion of the neck. The flexion of the neck is by sternocleidomastoid. We have discussed the same question in different contexts today. Answer is option B, sternocleidomastoid muscle. So that's all for today's. Thank you for joining. Thank you all for joining.